Mary Tally Bowden. Believe it or not, this is my first press conference. I ask you to be nice. I have four very protective boys that know how to access my Twitter account, and they have no filter, so please be nice. It's hard for me to believe that I'm sitting here. About a week and a half ago, my frustrations came to a head and sent an email to my patients. And I'm a small practice. I'm a solo physician. I've been here for 2 years. I started off with the intention of just doing ear, nose, and throat and sleep medicine, and somehow stumbled into COVID. I was just responding to what my patients were asking me to do. They wanted to get tested because they didn't have access to testing, and I found a way to do that. And I never rationed testing. I provided access when access was hard to come by. So over the span of the pandemic, I've been open 7 days a week. I've tested over 80,000 people, and I have treated about 2,000 people. I'm a good doctor. I fight for my patients. I treat my patients the way I would want myself treated. I've been on the other end of the patient-physician relationship. As a mom of 4 boys, I basically spent 5 years as a patient, 5 straight years of pregnancy. So I know what it's like. And when I opened this practice, my intention was to treat people the way I would want to be treated as a patient, and to treat people the way I would treat a loved one. And that is how I have treated my patients during COVID. So it was quite a surprise to me last Friday when I got a text message from the Houston Chronicle telling me that my hospital privileges had been suspended. It's not the way things like this are normally handled. I have very loose ties to Methodist. I only have privileges there in case I have a patient that is so sick that they need to be hospitalized. And I'm proud to say that because of my early and aggressive treatment for patients with COVID, I have not needed to admit anybody to Methodist. So I'm not quite sure why I became their target, although I think based on their history of being the first hospital in the country to mandate vaccines for their employees, that they are using me as an example based on what they have read, which I have not sent to them, but I've sent to my patients, and I have vocalized on Twitter. But since when is that a reason to take away somebody's hospital privileges, try to take away their license? I'm not saying Methodist is doing that, but there are groups that are targeting doctors like myself that are just simply trying to speak about what they are seeing. And I don't have research papers to back what I'm doing personally. I have tons of data. I have tons of clinical experience. And when I speak to my patients about what is going on, it is based on my clinical experience. And that should be good enough. And I'm not sure in this day and age, apparently it's not. It's astounding to me as a physician that I'm not entitled to my medical opinion. I think this is hopefully, this is not how I wanted to be. I would like to go back to my clinic and stop. I do not want to be in the media, and I do not appreciate the way Methodists handled this. I'm simply trying to help my patients.
So, Doctor, why hold a press conference?
Because my name is being vilified. I have people leaving fake reviews on my website, all over the media. I have people calling me a sister of the devil and misconstruing my intentions. So I want to set the record straight. I don't feel like I'm getting fair coverage of my side of the story.
Dr. Bowden, I guess the issue from Methodist standpoint, some of the people online, is that you're using ivermectin, which has not been proven effective by the FDA against treatment of COVID-19. I guess kind of explain to us why you have used it to treat patients.
Well, when I did a survey of all the patients that I've treated with monoclonal antibodies, and I asked them what medications they're taking, 30% of them said they are taking ivermectin, which is a large number of people. I don't know how ivermectin has become a dirty word. It's a safe medication, and I would never give anything to anybody that I thought was going to hurt them. And I did deep research into whether or not I thought it was going to hurt them. So I stand by ivermectin. I have plenty of people who have taken it, and no one has had a serious reaction from ivermectin. Again, it's clinical experience.
So the 30% of patients that you surveyed, are they the ones that you treated with ivermectin or others?
No, the 30% of the patients that I've treated with monoclonal antibodies all told me they were taking ivermectin at the same time.
Doctor, what's next for you? What do you go from there?
Continue doing what I'm doing.
Are you considering any kind of legal action against Methodist at this point?
I'm not going to comment on that.
Have you had any conversations with anybody at Methodist directly, either?
No.
So all of this has happened through social media or what you've
Well,
read?
they have sent me official letters, but there have been no conversations.
Do you plan to have any?
I'll have to ask a lawyer. I don't know.
What's the message does Methodist you want to deliver today?
Well, Methodist has touted itself as the example that the rest of the country should follow in terms of vaccines. But why are they not sharing with us more data? Why do we not know how many breakthrough cases they have? Why do we not know how many patients who have been vaccinated have had side effects? Why do we not know a firm number of the patients in the hospital who are vaccinated? So if they want to be the leaders in COVID, then they need to share all the data. They also need to perhaps not vilify doctors who are challenging what the vaccine movement.
I have a question. So the people that came, you said you treated people for COVID, am I right? Okay, so that treatment ever included the vaccine, or it was just?
I tried to get the vaccine to my clinic when
Okay.
it first came out, and I could not get it because I was not a hospital. I basically felt like I was too small to be worthy, so I just gave up. So no, I don't distribute the vaccine.
So I do take that. You wanted to give the vaccine out. You were
Yes,
interested.
I was on board with it. I tried to get it, and
So
they were
you
just
have-
giving it out to the hospitals, and
You
I
have
gave
nothing
up.
against the vaccine.
Nothing against the vaccine. I don't think there's a one-size-fits-all for the vaccine, but I have nothing against it. And there's certainly an important tool against this pandemic.
Did you take it as part of Methodist's requirements?
That is not something, I don't even ask my patients that, and I am offended that other people would ask me that. It's a HIPAA violation. It's a personal health information.
Yes.